আজকে আমরা কার্ড 4 এটা নিয়ে আলোচনা করব। কার্ড 4 এর ফার্স্ট কোশ্চেন ছিল হোয়াট ইজ syncope? So I think you know syncope means sudden loss of consciousness. Sudden কথাটা খুব ইম্পর্টেন্ট, sudden loss of consciousness. এখন if consciousness lost over days, it is not syncope. Sudden loss, transient loss of consciousness. এই দুইটা কথা মনে রাখতে হবে। Due to reduced cerebral circulation, there is no organic lesion, only there is deficiency of cerebral circulation. It is syncope. And there are different types of syncope, vasovagal syncope, and his spelling mistake আছে, vasovagal syncope, cardiac syncope. As for example, severe aortic stenosis, hypertrophic cardiomyopathy, the patient may develop syncopal attack, myocardial infarction, syncopal attack. This is cardiac syncope. Postural syncope, elderly patient due to postural hypotension taking some diuretics can develop postural syncope. So this is the different types of syncope. Our next question, what are the causes of hematemesis and melena? It is very popular question for Viva. First answer will be PUD, septic arthritis. Second is esophageal varices. Third, gastric irritation. Fourth, stomach. But the commonest cause is septic arthritis. You must tell it first. Then you will tell esophageal varices, because the hematemesis or melena due to esophageal varices is a life-threatening disease. So you must tell it in second position. Gastric irritation, less harmful. And stomach, its incidence rate is very low. So you will tell in this sequence. Our next question, what are the presentation of migraine? So triad of symptom of migraine. One is headache, second vomiting, third aura. Or you may tell aura, headache, vomiting. Aura means zigzag line in front of the eye. And headache, it has migraine headache has some special quality. It is usually unilateral, maybe bilateral. First thing. Second, headache is episodic. It is not persistent headache, but it is severe. It is severe, and this headache is associated with vomiting. So unilateral headache, episodic headache, severe headache, vomiting with aura, diagnosis of migraine. Our next question, what are the ocular manifestation of rheumatoid arthritis? And the ocular manifestation of rheumatoid arthritis is scleritis. Scleritis means inflammation of the sclera of the eye. Episcleritis, margin of the sclera and adjacent conjunctiva affected. And keratoconjunctivitis. Keratoconjunctivitis Sika. Sika means dryness of the conjunctiva, and kerato means cornea. When cornea and conjunctiva are affected with dryness of the conjunctiva, it is called keratoconjunctivitis Sika. And scleromalacia, so it is the late at life-threatening stage of the corneal lesion in rheumatoid arthritis. Our next question is how to diagnose scabies. Scabies is usually diagnosed clinically, but If you want to confirm the diagnosis of scabies, you must isolate the mite of the Sarcoptes scabi from the burrow in the interdigital space of the fingers with blunt needle and seen under microscope. It is the confirmatory diagnosis of scabies. Our next question is, what is the presentation of Plasmodium vivax? So you know there are Plasmodium vivax, Plasmodium melody, Plasmodium ovale, and Plasmodium falciparum. There are 4 types of malaria. So Plasmodium vivax and ovale, it has similar characters. That is, it produces tertian fever, tertian type of intermittent fever, and that means fever comes on every 48 hours. And this fever has 3 stages. Cold stage, which comes with rigor, shivering, and persists for half an hour to 1 hour. And next stage is hot stage. In this stage, patient suffers from high fever, and the fever persists for several hours, even 1 day or 2 days. And then disappearance of fever with profuse sweating, not simple sweating. Every fever subsided with sweating, but malarial fever subsided profuse sweating. What are the features of rickets? Ricket is a metabolic disease of the bone which occur in children due to deficiency of vitamin D. And ricket child looks healthy, but the muscles of the child or baby is very soft and flabby and weak. Patient milestone of development is delayed. Patient cannot sit, stand, walk in time. And there may be delayed closure of the anterior frontonelli and late ossification of the front skull bones. And later on, there may be knock knee and bow legs, and swelling of the costochondral junction of the chest, that is called ricket rogeri. So these are the change that occurs in your ricket. Our next question is, what is Klinefelter syndrome? Klinefelter syndrome is a chromosomal disorder which is occurred mainly in female, and its karyotype is 47XXY. And clinically, the patient is tall, and there may be gynecomastia, small and lack of secondary sex characters, and the patient have learning difficulty. There is mental retardation. Our next question is, what is osteoporosis? It is a metabolic disease of the bone where there is decreased bone mass density, and which causes micro architectural deterioration of the bone. Micro architectural deterioration of the bone tissue, and it leads to increased risk of bone fracture. So first thing, there is decreased bone density. Second, there is loss of architecture of the bone. Third, there is increased chance of fracture of the bone. These are the 3 changes that occurs in osteoporosis. Our next question is, what is the clinical presentation of acute coronary syndrome? I think you know acute coronary syndrome indicates two diseases. One is unstable angina and another is acute MI. And the acute coronary syndrome present to a patient present with severe central chest pain, which radiates to left shoulder and left arm, and it is associated with sweating and vomiting. And some patients of acute coronary syndrome may present with complications like shock, cardiac arrhythmia, and acute LPF. Our next question, what is hematemesis and what is melena? Hematemesis means vomiting out of blood or coffee ground vomitus, that is black vomitus. And it occurs due to less bleeding from upper GI tract. And melena means patches of black tarry stool contain the altered blood, not affected blood. Tarry stool due to altered blood, which occur due to bleeding from upper GI. What are the causes of papilledema? Papilledema means swelling of the optic discs, and it has systemic cause and some causes due to raised ICP. Systemic causes are hypertension, vasculitis, and raised ICP cause ICSOL, intercerebral hemorrhage, meningitis, brain abscess, and idiopathic intracranial hypertension. What are the diagnostic criteria of rheumatoid arthritis? And there are 8 criteria of rheumatoid arthritis. First criteria is arthritis of the hand joints. Second is symmetrical arthritis. And third is polyarthritis. That means more than 4 joints are affected. And fourth is muscle stiffness of an morning stiffness, more than 1 hour. And rheumatoid nodule is present, RTS positive, and radiological change in hand. And I think you know what are the radiological change. That is soft tissue swelling, decreased bone density, periarticular osteoporosis, marginal erosion. So these are the change, radiological change. And clinical symptom duration must be more than at least 6 weeks. So if any 4 out of 8 criteria is present, it is next question, how to treat scabies. So specific treatment and general measures. Among the specific treatment, aqueous solution of artemisinin, skin ointment, and 2 times 1 week apart should be applied in whole body except face, and antihistamine tablet. And general measures, all family members or contact person should use same drug at a time, and all used clothes and beddings should be washed in the next morning. What is the treatment of paucibacillary leprosy? Paucibacillary leprosy is a tuberculoid leprosy, and it is treated by 2 drugs. One is rifampicin and second is dapsone. Rifampicin dose 600 mg monthly for 6 months, and dapsone 100 mg daily for another 6 months. For 6 months. Total 6 months treatment should be given in paucibacillary leprosy. What is autosomal dominant disorder? It is a genetic disease which is expressed in heterozygous state. That is, either or father or mother should be affected, and both male and female offspring are affected. Mutation usually occurs in a structural protein gene. 50% of the offspring of the affected parents will be affected, and 50% will. Our next question is what are the causes of atrial fibrillation? The cause of atrial fibrillation are mitral stenosis, hypertension, ischemic heart disease, cardiomyopathy, thyrotoxicosis. These are the common causes of atrial fibrillation. What are the causes of headache? There are two types of headache. One is tension headache, primary and secondary. Among the primary, tension headache, migrainous headache, and cluster headache. Among the secondary, sinusitis, meningitis, encephalitis, axial, and subarachnoid hemorrhage. Now, what is hematophagia? Hematophagia means passage of fresh blood or rectum which occur due to bleeding from lower GI. What are the organism causes septic arthritis? Common organism causing septic arthritis are Staphylococcus aureus, disseminated gonococcus. These two are the common causes, but Streptococcus group A, pneumococcus, meningococcus, Haemophilus influenzae usually affects the elderly patients. Now, what are the features of osteomalacia? It is also metabolic bone disease in adults, and it is characterized by generalized body ache, including muscle and joints. And patient feels pain during standing from a squatting posture. Proximal myopathy commonly occurs. Patient may walk with waddling gait, and patients should struggle to climb upstairs and to get out of chair. There may be bony or muscle tenderness, and in the back there may be bony fracture. Write down the presentation of measles. The measles presents in three different phases. First phase is prodromal phase, and in this phase, it is characterized by conjunctivitis, rhinitis, and there is public spots in the oral cavity, and public spots is a white spot surrounded by red zone in the against the last molar teeth in the oral cavity. It is diagnostic of your measles. And this prodromal stage usually lasts for 3 days before rash appearance. And next stage is exanthematous stage. It is characterized by erythematous maculopapular rash, which spread from face to hands and legs. And some patients may develop complications like pneumonia, gastroenteritis, meningitis, encephalitis, lymphadenopathy, otitis media. And what is autosomal recessive disorder? Autosomal recessive disorder is a genetic disease expressed in homozygous states. That means both mother and father should be affected. And in this disease, male and female are both affected, and there is defect in the enzymatic protein. 25% of the offspring will be affected, and 25% will be healthy, but 50% will be carrier. And Wilson's disease is an example of this autosomal recessive disorder disease. Next is how to manage a patient of OPC. organophosphorus compound, poison. General measures: maintain of ABC, skin and clothing should be washed, and gastric leprosy if patient comes within 1 hour, catheterization of the patient. And a specific measure: injection atropine 3 ampoule IV start, then 10 minutes interval repeated till full atropinization of the patient, and which is characterized by dilatation of the pupil, tiredness of the mouth, and tachycardia. And injection pyridoxine is another antidote. It is given 2 gram IV very slowly, 6 hourly. Injection ceftriaxone can be given to prevent infection. Injection diazepam sometimes given in convulsive patient. Now the last question, I think, what are the skin manifestation of PKDL? So I think PKDL means post-collagen dermal leishmaniasis. It occurs 6 months to 3 years after visceral leishmaniasis. Rash, nodular rash, and macular rash, and lesion, and there are like effects. There hypopigmented macular lesion all of patient. So I think this is the end of our class. So এখন এই ক্লাস কি তোমাদের বসতে অসুবিধা হয়?
না
ক্লাসে
স্যার।
বসতে অসুবিধা
না
হয়?
স্যার।
হ্যালো, অসুবিধা হয় না? আচ্ছা
না স্যার।
তো এখন তোমরা এই কোশ্চেনগুলি যেগুলি এখন পড়ানো হচ্ছে এগুলি রেগুলার পড়ে ফেলবা যাতে থিওরিটিক্যাল পড়াটা এই বন্ধের মধ্যে হয়ে যায়, এবং কলেজ ওপেন হইলেই তোমরা শুধু পেশেন্ট দেখে পরীক্ষায় বসে পড়বে, এই হচ্ছে তোমাদের কাজ।
স্যার আমাদের কি পরীক্ষা নভেম্বরেই হবে?
পরীক্ষা কখন হবে এটা ডিসিশন এখন হয় নাই। এখন চিন্তা চলতেছে সাপ্লিমেন্টারি ব্যাচের পরীক্ষা নিয়ে। এটা যদি হয় তাহলে বুঝতে হবে যে তোমাদের পরীক্ষা তারপর পর হবে, আগে এটা হয়ে যাবে, এটা নিয়ে আলোচনা চলতেছে, দেখা যাবে। তো তোমরা প্রিপারেশন নিতে থাকো। হ্যাঁ
জি স্যার।
কলেজ করলে যেন আর তোমরা না বলো যে স্যার আমাদের আরো কয়েকদিন সময় দরকার।
জি স্যার।
এখন পড়াশোনা ডেইলি পড়ো, ডেইলি 2 ঘন্টা মেডিসিন, 2 ঘন্টা সার্জারি, মেডিসিন অ্যান্ড অ্যালার্টস 2 ঘন্টা, সার্জারি অ্যান্ড অ্যালার্টস 2 ঘন্টা, বললেই যাবে। So thank you, and I again try to
thank you sir
for your healthy and peaceful life. Thank you all.
जी sir, assalamu alaikum.